Hello friends, welcome back to the channel. Perhaps you've heard of intermittent fasting or high intensity interval training, and maybe you've even tried each of these or both of them. But have you ever wondered what exactly happens in your body when you combine both of them? I'll show you the result of a surprising experiment that could be an opportunity in your health journey, so you're not going to be jumping in blind into things that you might be trying. And just as a reminder, I'm a doctor, but I'm not your doctor, and everything here is just educational and entertainment based and not personalized medical advice. So here's the study that I'm going to be going over with you. It's called Unlocking the Power of Synergy, High Intensity Functional Training and Early Time Restricted Eating for Transformative Changes in Body Composition and Cardiometabolic Health in Inactive Women with Obesity. So that's a mouthful, but I'm going to just translate that for you. So high intensity functional training is another word for HIIT, HIIT, high intensity interval training. And early time restricted feeding is another word for intermittent fasting. And the word early there just means that the period of food consumption was earlier in the day as opposed to later in the day. And we know that's better because it matches the natural circadian rhythms of the body to be eating when the sun is out and not when the sun is down. And in the study, they looked at body composition and cardiometabolic, meaning cardiovascular and other metabolic outcomes. And the population that was studied was females who were struggling with obesity. But the results should be broadly generalizable, although technically that is the study population. Okay, so what did they do in this study? This is the overall flow for the study. People were randomized, meaning they were put into one of three conditions. TRE means time-restricted eating, or the HIIT group, which is high-intensity interval training, or a combined group, TRE-T. Through randomization, we know that any differences between the groups are going to be minimized because they're randomly assigned to different groups. Okay, so now let's look at what the time-restricted eating group was doing. So here, people were only allowed to eat for less than 8 hours per day as an eating window, and during that time, they could eat as they desired. So what we see here is that there is a baseline of 1 week where people were randomized to these different groups. They became familiar with the study, and as you can see here on the left, they got a body composition analysis, they got blood pressure done, and they had blood sample collections taken. Then the actual study randomization was for 12 weeks. So for 12 weeks, they were in one of each of these three groups only. And then after 2 days, at the end of the study, they got these repeated measures of body composition, blood pressure, and blood sample collections. Now, just remember, in the time-restricted eating group, they were only eating in an 8-hour window, and the specific things that they were to eat were up to them. So the study didn't tell them exactly what to eat. They just restricted the time period. This is the high-intensity interval training description. So what did people do in that group? Well, it was 12 weeks overall, and for the first 6 weeks, they did exercise that lasted 45 minutes, and what that exercise consisted of was an exercise bout with a recovery session of 10 or 20 seconds. For the following 6 weeks, the exercise duration increased to 55 minutes per session, and the recovery duration got up to 30 seconds in duration. So overall, 12 weeks of exercise in a high-intensity interval style, and the kind of things people did were aerobic exercises as well as resistance training. Aerobic exercises included things like jumping jacks, high knees, burpees, and resistance training included things like lunges, push-ups, deadlifts. And then for each exercise session, there were 8 sets, meaning they would repeat things 8 times, and then they would rest 2 minutes between each set. So not bad, pretty good for an interval training workout. All right, so let's take a look at some of the results here. So the first thing we can look at is body composition. Quite interesting is that the red group, which is time-restricted eating, and the high-intensity interval training group is blue, and the combined group is this brown color. So what you can see is the star shows that something was statistically significant. So the waist circumference was actually something like 7% lower after these 12 weeks. And we see differences between these groups. And the same thing with fat mass. You had a 20% reduction in fat mass with a combined intervention here. And overall, you see improvements in a lot of different variables. This graph and the following graphs are by Perry Wilson. So overall, that's a pretty impressive finding. We're seeing main effects as well as combined effects. Now let's look at blood pressure. Similarly, what you can see here is that blood pressure goes down pretty much for all three groups, but it doesn't look like there's a huge difference between the combined group and just the high intensity interval group. and it looks like there's not much of a change with the intermittent fasting group. But overall, still pretty impressive findings to have something like a 5% reduction in blood pressure in only 12 weeks. Now let's take a look at glucose and insulin. And similarly, what you see here is the combined group does much better than the other groups, and they're statistically significant, specifically for one's insulin level and the HOMA-IR, which is another metric of insulin sensitivity. And you have these dramatic reductions, something like 40, 50, 60% reductions in the combined group. Wow, that is pretty cool. Now, what about lipids? Because lipids are also a concerning metric for cardiovascular health. And similarly here, we see total cholesterol is overall down, triglycerides are overall down, HDL is the good cholesterol, that's up, and LDL is down, the bad cholesterol. But statistically significant effects are only seen with triglycerides and total cholesterol, but all of these are trending in a good direction. So wow, that's pretty impressive too. How about dietary intake? In terms of overall calories consumed, we see a difference in the combined group, but even in the other groups, we see reductions in caloric intake, carbohydrates, fat, protein. And the protein there is concerning because when you're eating less protein, that's where there's a risk of losing muscle mass as well. And I think Perry Wilson did a great job with these charts. All right, so in terms of these results, they are fairly large effect sizes. They're not tiny results. So that's really important to know. And we see multiple synergistic effects, meaning when you put the two interventions together, people do much better than alone, specifically in fat mass, waist circumference. And waist circumference is really important because that represents often visceral fat, which is the dangerous fat surrounding your organs and giving off all this inflammation, kind of like having a slow leak of inflammation throughout your body. Decreases in caloric intake, in insulin levels, and lipids. Overall, it's really impressive and I think very inspiring results. But the most interesting thing, I think, is when you combine these, you have preserved or even increased muscle mass. And that is something that's very hard to do because when you take a weight loss medication, typically people will lose a lot of weight, but a lot of that's going to be muscle mass. Something like 30, 40% of the weight loss is muscle loss. And the same thing is often seen in calorie restriction alone. If you put somebody on a 1200 calorie diet, they're going to lose weight, but we want to spare the muscle, the good stuff, and get rid of the unhealthy stuff, the unhealthy types of fat. So I think one of the main takeaway messages here is that by combining these two, you're going to preserve muscle mass while also losing fat. And that is really the holy grail of obesity medicine. And just to emphasize that, I want to go back and show you that graph once again. All right, so check out this graph once again and just see how cool this is. So fat-free mass is your body mass that is not including fat. So that could be muscle, but also things like bones, ligaments, tendons. But we can assume this is a proxy for something like muscle mass. And as you can see here, with time-restricted eating, which is basically the fasting, you lose a little bit of fat-free mass. You lose a little bit of muscle. But with high-intensity training, you gain. And similarly, when you combine, you gain. So it seems like the preserved muscle mass effect is being driven primarily by the high-intensity interval training, not by the intermittent fasting. So that's really important to know. When we look at these results, we can modify the saying that abs are made in the kitchen. Yes, that's true, but abs are preserved through high-intensity interval training. Just remember that. There also are some limitations to this study. It was a small study, and there was no control group here. What that means is there was no group of people in the experiment who just hung out and did similar things but didn't get the active intervention. Now, this might explain why the high-intensity interval group showed less food intake. It's not really probably because the actual high-intensity interval training caused them to eat less, because typically we know when we do exercise, and especially high-intensity exercise, people will eat more because of a compensation mechanism, a homeostatic compensation mechanism in the brain. So the fact that these people ate less probably suggests there's some other thing going on here, like a side effect of just tracking their food, because everyone here had to track. So maybe just the process of tracking their food made them eat less. So that's just a caveat to keep in mind here. So thanks for listening. And if you want some help with understanding some of these things more, please check out some of the products I recommend relating to these topics. And if you want to see more stuff like this, please do like and subscribe so I can know that you're interested. I can try to make more things that you're interested in. Thank you so much. Take care.